benefits did they access? That is contribution.
Speaking during the COG quarterly meeting, COG Health Committee Chair Muthomi Njuki noted that the new health scheme being rolled out is marred with irregularities and confusion, with the counties being reduced to bystanders.
The decision IPA has not been signed to date by any county, yet implementation has already started. PS, what are you basing this on? I mean, in my county, you're already there, you already launched. I've not signed anything. I mean, is this a trial, or are you saying whether I sign or not, you'll still go on?
Further highlighting the faults with the scheme, Muthomi noted that patients suffering from chronic diseases were in danger as there was no cover for them after NHIF stopped services 2 days ago, adding that the contracting of healthcare providers was not complete and yet the rollout had already begun.
Patients who need services for the treatment and management of chronic diseases cannot access services since the emergency, chronic and critical ill covers have not been activated. We are still at the primary level and the SHIF. But what about those who are chronically ill and they know that from the information you've given, they are supposed to be accessing the service? Do we have a time period which they are supposed to wait despite having an emergency or chronic illness for them to access the service?
The PS for Public Health, Harry Mutai, while admitting that the registration process for various stakeholders had experienced challenges, assured counties that significant progress was being made on the same and confirmed the government was seeking an extra 65,000 devices for all public health facilities.
I want to report that indeed there is a significant progress, and for the first time we have seen the highest number of county health facilities being registered for the purpose of being in panel with the now Social Health Authority, and we expect that was one of the biggest challenges that the Excellency Governors were asking, how come NHIF then was not paying money to these facilities? We realized there was a challenge in terms of registration and empanelment.
On her part, the chair for the CEC Health Caucus, Roslyn Omolo, questioned the implementation and period of the program, calling on the SHA to provide clear directions on the same.
Last week we asked, what is the implementation period and the implementation plan? We know the rollout was done in 15 counties, but we also know we have 47 counties. So what about the other 32? What happens? Are we on our own? Do we just proceed? How does this work?
This was echoed by her Nandi counterpart Ruth Koech, who said that counties were owed over 30 billion shillings by the defunct NHIF, and it was not clear how this would be resettled.
We looked at the cancer patients who will need 85 billion. So the numbers for planning versus the reality of the funds available, we must be very careful to win the confidence of our citizens by promising what we can really deliver.
Alan Owino for K24.